Hello, I'm Kristen Knoll, and welcome to Hometown Miracles, the show that takes you inside Covenant Healthcare to witness firsthand the types of medical miracles that happen every day. As we know, the human body is an extraordinary piece of mechanical equipment. It lifts, bends, pulls, pushes, and enables us to perform leisurely activities like going for a morning jog, to simple tasks like holding a cup of coffee or biting into an apple. Like machines, every now and then our bodies need a tune-up. In the next 30 minutes, you'll hear personal stories of physical reconstruction that take place right here in the Great Lakes Bay region. You're watching Hometown Miracles inside Covenant Orthopaedics. Orthopedics is a medical specialty that focuses on injuries and diseases of your body's musculoskeletal system. The system includes your bones, joints, ligaments, tendons, muscles, and nerves. According to the American Academy of Orthopaedic Surgeons, in the United States alone, thousands upon thousands of people per year visit an orthopedist with sports-related, work-related, home-related, and trauma-related orthopedic injuries. People come from all over the country to receive treatment from the orthopedic surgeons at Covenant. Collectively, those surgeons perform more than 3,200 orthopedic procedures each year.
We have a phenomenal group of physicians, and the staff that support those physicians are phenomenal. We have nurses, surgical technologists, and ancillary staff, including anesthesia support from nurse anesthetists and anesthesiologists that make the orthopedic team excel compared to many other organizations. And a lot of that has to do with the cooperation as when I refer to a team, it's the entire group of staff, physicians, engineering, housekeeping, everybody that's involved in providing quality of care.
The team collaborates to keep the Covenant operating rooms at the highest quality standards.
Infection control, we have a 0.73 infection rate, which is benchmark in the country and very low, and we do that because we have a phenomenal team that works together to make sure we provide the best quality care.
Orthopedic surgeons, or orthopods, are the specialists who manage problems of the musculoskeletal system. They are involved in the diagnosis, treatment, rehabilitation, and prevention of orthopedic injuries. Most orthopods have a focused area of interest that is special to their practice, from hip, shoulder, and knee replacements to sports injuries like a torn ACL. They keep our bodies moving properly.
This is my art form. This is my life's calling. So yeah, I always feel good every day because it's not work.
For years, the basics of orthopedics have remained the same. However, there are noticeable differences in the field.
It's all been refined and honed to a finer edge. The implements that we use for our joint replacements, the procedures we do in sports medicine injuries have just hit a much higher level of functionability and long-term good outcomes. We were all taught those back in the day, but I think technology is making them more approachable, more attainable from the vast majority of patients.
The orthopedic surgeons who practice at Covenant have a profound interest in the work they perform.
I initially wanted to do research in orthopedics, and when I started my clinical rotations, I just fell in love with patient care. And I realized how fun it was and how much you could really throw your entire existence into clinical orthopedics.
Wasn't much of a student originally in school. Was playing football and thought myself quite good at that. Really wasn't, but thought I was. And got hurt, and there was a gentleman by the name of Ben Main, who was a long-time orthopedic surgeon here in town. He took care of me, and my senior in high school took me in the office with him, took me to the OR with him, and that's where I got interested. And so it life changed. God smiled on me on the day I got hurt playing football.
Dr. Ken Dissler says it's the patients that make his job so rewarding.
I think the most outstanding patients as far as results have been my rheumatoid patients. I have one patient in particular who was in a wheelchair, and we did 2 total hips and 2 total knees, and I'll never forget her walking into the office under her own power with tears just rolling down her face, and it's just awesome. And to take people who are not walking and to allow them the opportunity to get their lives back and get their independence back is very satisfying, and I think that's one of the things that keeps me personally going and keeps us going as orthopedic surgeons.
Take Dr. Mike Woolahan, for example. A native of Saginaw, he completed his undergraduate studies at the University of Notre Dame, medical school at the University of Michigan, and residency at the Harvard Orthopaedic Combined Surgery Program. He came home to Saginaw to be close to his family and start his practice. In his 21 years as an orthopedist, Dr. Woolahan says,
Covenant has some outstanding people. Their technicians, surgical technicians, and the nursing staff they have in the operating room, as well as the preoperative nursing staff and the postoperative nursing staff are outstanding, fantastic people. And some of the techs and nurses that I've had the privilege to work with at Covenant are literally some of the very best people that I've worked with in my entire career.
These surgeons choose to practice at Covenant for a variety of reasons. The major factor? This is home.
So the advantage that we have at Covenant, I believe, is that we brought these hometown and yet world-trained people in the medical field back to a Covenant hospital that allows a Tim Wenzel to give me the environment that I have a OR crew that's world-class, that I have an ability to bring world-class orthopedics to our town, which is also our hometown.
Today, 2 patients who are worlds apart share with us the patient's view of orthopedics. When you think of the typical candidate for hip surgery, your mind likely shifts to a man or woman over the age of 50. However, our first story is that of Andre DeGusti, a 6-month-old boy from South Africa and a Covenant orthopedic patient. It is 8,524 miles from Andre's home in Johannesburg, South Africa to Saginaw, Michigan. However, it was not too far for some local physicians to make a difference in a young family's life.
They weren't actually very helpful with Andre's condition. They were just like, well, accept the fact that he's got sacral agenesis, and they were just, very, I don't know, unhelpful.
Like
very unemotional.
I would think they're just like, well, that's it, and so on, and see what happens. And like here, the doctor would say, okay, well, it is a difficult case, but let's see, this is the problem, and this is the problem. Let's see if we can't sort this out, and then sort that out, and then we go further and sort that out.
Okay.
Kind of like that.
Yeah.
Yeah. Over there, like what he actually had done here is just hip positioning. I mean, I guess they can do it there because they do hip replacements there. And
no
one
even bothered to X-ray his hips.
to kind of think about it,
Fate would bring a Covenant plastic surgeon to South Africa as Dr. Arno Weiss was on safari about 6 hours away from where Andre was being diagnosed.
Emailed me from South Africa. He was over there hunting and had a clinic as well, and saw Andre as a patient in the clinic, and then he sent me some pictures of him and said, geez, Tony, what do you think he's got, and what can be done for it, and who do you think he could see over here, because they were having some issues over there with seeing physicians.
Dr. Weiss saw the child and found out that South African surgeons told the family that amputation was the only option.
They were just nice people. They were devastated, and I mean, I could only imagine that if I had been the parent, doctor came out and said we need to just cut your baby's legs off, how I'd have felt.
Right.
I mean, that was had to have been the bottom of the world. And I mean, when they called me and asked me if I would see this child, I was like, you know, I felt so sorry for them, but, you know, I'm thinking, what the heck can I do? Well,
what Dr. Weiss did was arrange for the DeGusti family to come to the United States. After a 23-hour flight, Amore, Dino, and Andre were busy meeting with orthopedic surgeon Dr. Anthony DeBerry, pediatric cardiologist Dr. Hani Zurich, pediatric intensivist Dr. Michael Stargard, and neurosurgeon Dr. Frank Schinko.
We certainly see a lot of similar cases. Sacral agenesis of the magnitude that he has is actually extremely rare. He has basically lost the growth and development of the lower half of the lumbar area of the spine, as well as the entire sacrum.
Due to Andre's condition, his hips were severely dislocated, and various tendons in his legs and feet needed to be lengthened. All of these issues would have to be addressed in the operating room.
You can see with him that he doesn't have a lot of motion of his hips. See how his hips are really tight this way? And they don't flex down either or extend. They're kind of staying flexed up that way. So he's got some real good contractures in his legs. He's got, again, the club foot here, but that corrects nicely, although this big toe doesn't want to extend on either foot.
During the surgery, Dr. DeBerry hypothesized that while Andre was born with sacral agenesis, his hips were dislocated before his birth.
It's called a teratologic dislocation because he probably was dislocated in utero. And of course, with the fact that these little guys don't have much in the way of bony structure, it's all cartilage when they're first born. You can't see that at birth. He should have been treated earlier on with either a brace or something like that very early on, but they never did anything about it. Of course, the treating doctors in South Africa wanted to do an amputation of both legs.
Throughout the 1.5-hour surgery, Andre's family waited anxiously for the outcome.
When I'm older, I will go to Covenant for my triple bypass.
I will ask them for an epidural before I deliver twins. They will take care of my diverticulitis, my appendicitis, my gallstones. I love Casamanders. I will be amazed by their advanced robotic surgeries.
Covenant will be there.
And I'm old and gray, like they are now.
Covenant Healthcare, extraordinary care for every generation.
While Andre was born with his disorder, many people develop the need for surgical intervention over time. As our bones, joints, and ligaments endure daily wear and tear, they often fail us. Next, we'll meet Al Blink, a local resident, decades ahead of Andre, as he prepares for his elective total knee replacement. Al lives a busy life, going nonstop between work, family, and leisure. However, pain in his knee began to get in the way of his busy schedule.
I guess it all started probably about 4 years ago when never having any problems at all with my knees. My wife and I had taken swing dancing lessons in preparation for the station's Christmas party. And we had got all set for it. We were all set, ready to go. And I was dropping off video at the video store, and I got out of the car, I twisted my knee, and something popped. And as soon as it popped, I had pain. Pain never went away. It's a period of time, I went to the doctor. They did, I think it was arthroscopic look at it, and found that I had osteoarthritis, and it had affected half of my knee, and that the cartilage in there had shattered.
Over the past 4 years, Al has undergone various procedures and tried a variety of treatments to help stop his pain. Most of these methods were temporary fixes and over time proved unsuccessful.
If everything goes as planned, I'll be able to walk without limping again. Every time I get up, I won't have to be real ginger on the knee, and people stop telling me I lean to one side when I walk around here.
Al has high hopes for his total knee replacement.
I'm hoping that the surgery will stop the pain that I've had for years and years and years.
Al jokes.
If everything goes the way it should and recovery time goes on, that I should be able to play tennis at some point in time. I don't play tennis, but I like to golf.
Al chose the right place for his surgery. The Covenant OR is ranked 3rd in the state for total joint replacement volumes, performing more than 1,358 total joint replacements each year. Al's surgery involved many parts and pieces, including an implant comprised of 4 main components.
Normally there's 4 parts. There's the femoral component. The tibial component is 2 pieces. There's the metal base plate and the plastic, and then there's the patella component. So he already has the patella component in from his last surgery. We don't need to change that. So here's the tibial plastic now that we're going to put together. Dave has his tibial component there. I'm adding pieces on this one because I needed to make this much more stable because he'd already had the previous knee. So we're going to put in a stem that will attach to the bottom of the tibial component, which we normally don't use in a primary knee. So this thing is just going to go in like this. And actually just bang it in so you get a good wedge fit there. There's some extra little screws. Gonna lock that in. Just for extra protection so it doesn't come out. And then we're going to put on a wedge on him because he had some bone loss. And what we're going to do here, where's that other screwdriver there? So this is going to build up the inner side. When we put this in, we're going to make sure I get it in the right spot. There it is. So when we put this in, we're going to build up on the inner side because we had some extra bone loss on that side. So instead of filling it in with cement or cutting a lot more bone away, we can build it up with metal. So we're going to do 2 screws here. Okay, we get the cement going. And this thing is a torque wrench, so you can torque it. So the tibial component will be these pieces here, which is actually, because this is a revision, so this has got a little bit extra to it, but a little bit more beefy down here to stabilize it inside the canal more. The extra bone here. Tibial component otherwise is the same as what we would normally use. And then the femoral component Dave's got over there. Can you see that thing? And this thing, again, you can see what this does is just replaces about 9 millimeters of the end of the bone so that we can resurface the femur, actually. This component is made out of oxinium, which is a metal like titanium, and they oxidize the outer surface of this thing to make it into a ceramic surface so that when you link it with this cross-linked polyethylene, here you get very minimal wear over time. They did some studies showing that you get less wear in 30 years with this system than you would in a regular system in only 3 years. So it's pretty neat.
Al's new knee is composed of oxidium, a metal similar to titanium, oxidized on the outside to create a ceramic-like surface. The patient benefit? Minimal wear over time. This implant takes less wear in 30 to 40 years than would usually occur in 3. Physicians expect this knee system to last Al for the rest of his life.
Rehab-wise, it's usually about 6 weeks or so. You know, he'll have 3 days in the hospital, start therapy even this afternoon. We'll get him up walking a bit. And then usually we discharge patients to home after 3 days. They get therapy at home for a couple of weeks and then go to outpatient therapy. By 6 weeks, most people are doing really, really well. 3 months, they're doing a lot better. And then by sometimes up to a year before they feel like their knee is pretty normal.
While months of physical therapy and healing lie ahead, Al remains pleased with the care he received at Covenant.
I was treated very well at Covenant, though. You know, I was talking to some people, and they been in the hospital in the past and had things done where you spend extended periods of time in the hospital. And I found it interesting that usually there's one shift you can always complain about, or one group of people you can complain about. But the first time I had this done, I was in the hospital for a week, and I couldn't complain about anybody. I had great service, great care. And so I think when you come out of surgery, if you have good service, good care, it helps your recovery till you get home.
Back in the pediatric ICU, Andre took time to recover from the major surgery.
Oh, it was a long one. Everything went great though. Yeah, everything was fantastic. So the anatomy of his hips is just so distorted because I think these hips were probably dislocated since when he was inside of you. And we call it a teratologic dislocation. So the socket doesn't form normally. Now in a typical baby that it dislocates at birth, there's still a socket that's reasonable there. And the femoral head is round. So it's just a matter of getting it back in the socket. Now in his case, the socket was so shallow that it's really a matter of trying to find the socket in the first place, and that's what really took a long time, and then releasing all the tendons. So the hips, I have them spread out a lot more than I had originally planned, but they're in the sockets really good now, so I don't want to, I'd rather leave them like that, because that'll over time come back. The left knee is still tight. I tried to get it, I had him flexed about 60 or 70 degrees, so we may have to do something in the future again about his knee, but for purposes now, I thought this would be okay. He's not walking yet, so we don't have to worry about that. And honestly, even if we can never get his knee flexed more than it is now, he'll still be able to walk, so that's good, you know. So his toes popped right out. That went really well. That was the easiest part of the surgery. And then I've got him in this cast with his legs open. There's plenty of room to get to his bottom and private parts, so that he can do good. So.
And the sockets that are shallow, is that going to grow, maybe grow a little bit more?
Yes, and that's the idea. Once we get the socket, the hip in the socket, and we can keep it there, then that eventually it'll start to model and grow around the femoral head that he has. So God takes care of all of that stuff for us, thankfully, you know, so we don't have to do too much there. Now, over time, it may be that it doesn't completely develop, and there are still things that we could do in the future to fix that as well. So, but it's nothing like you were told in, back home.
The next challenge would be to keep the busy infant in his cast for 6 weeks. As Dr. Weir states,
it's not a piece of cake, and it takes work.
The 6 weeks passed, and Andre graduated from his cast to a plastic brace to support the healing of his hips. Physicians say this could be the last corrective surgery Andre's hips will ever need. They are optimistic he will walk one day.
On behalf of the Justi family, I want to thank all the staff and doctors like Dr. Stargard, Dr. Outwater, Dr. Schenko, Dr. Zrik, and the pediatric ICU and staff for giving your time and seeing us and helping Andre through this time.
Then we also just want to thank Dr. DeBerry and the Weiss family for everything that they have done for us. They truly are our second family.
And then thank you to Mr. Spence Metlow for covering everything and making it all possible. Thank you.
Every patient is different, but the goal of the medical staff is to give people the best opportunity to have complete and full recovery as best as is possible.
The physicians not only share their expertise here at Covenant, but they share that expertise throughout the world. We have many physicians that travel to other countries to take their expertise and bring that expertise that we have developed here at Covenant to other countries, and some of those people have come back to Covenant and have experienced the quality of care that Covenant offers anybody that comes to Covenant Healthcare.
A major part of what makes Covenant's orthopedic department extraordinary are the people within it.
Covenant has some outstanding people their technicians, surgical technicians, and the nursing staff they have in the operating room, as well as the preoperative nursing staff and the postoperative nursing staff are outstanding, fantastic people. And some of the techs and nurses that I've had the privilege to work with at Covenant are literally some of the very best people that I've worked with in my entire career.
We look forward to catching up with Al and Andre in the years to come for an update on their complete recoveries. As you've seen, the musculoskeletal system is a fascinating machine. Technology allows healthcare professionals to help people in our own backyard and across the globe more precisely than ever before. I'm Kristen Knoll. I hope you'll join us next time as we take a look inside of Hometown Miracles at Covenant Healthcare.